Our lungs are incredible organs, working non-stop to keep us alive by exchanging oxygen and carbon dioxide with every breath. Picture your lungs as an upside-down tree. The windpipe is the trunk, branching into smaller airways, ending in millions of tiny air sacs called alveoli, where oxygen enters your blood. When this system faces long-term problems, we call them chronic lower respiratory diseases. Chronic means these conditions don't go away quickly. They persist and affect the lower parts of your lungs, making it harder to breathe. These diseases cause inflammation and narrowing of the airways, obstructing airflow and making breathing a daily struggle. They're not just a smoker's cough or a normal part of aging. They're serious medical conditions that need attention. The damage often happens slowly, so early signs are easy to miss. The most common chronic lower respiratory disease is COPD, chronic obstructive pulmonary disease. COPD is an umbrella term that includes chronic bronchitis and emphysema, which often overlap. The main problem, it becomes difficult to push air out of the lungs, leading to breathlessness. These diseases are a leading cause of disability and death worldwide. Recognizing and understanding them is the first step to prevention and better health. Many people with COPD have features of both chronic bronchitis and emphysema. The common thread trapped air in the lungs, causing that classic feeling of breathlessness. Next, let's look closer at what makes up COPD. COPD isn't just one disease, it's a group of lung conditions that block airflow and make breathing tough. The two main types are chronic bronchitis and emphysema, and many people have both. Chronic bronchitis means long-term inflammation of the bronchial tubes, causing a persistent, mucus-producing cough for months at a time. The airways thicken and produce too much mucus, clogging the tubes and making it hard to breathe, like trying to suck air through a blocked straw. Emphysema damages the tiny air sacs at the end of the airways. The walls between air sacs break down, creating larger, less efficient spaces for oxygen exchange. Damaged air sacs lose their elasticity, trapping old air and leaving less room for fresh air. Both conditions lead to the same problem: air gets trapped, and you feel constantly short of breath. With chronic bronchitis, airways are narrowed and clogged. With emphysema, air sacs can't push air out. The result is a daily struggle to breathe deeply. Understanding these differences helps doctors tailor treatments. For patients, the main challenge is the constant feeling of breathlessness. COPD symptoms can affect every part of life, from walking to simply talking. Recognizing the signs early can make a big difference. Next, let's explore what causes these chronic lung problems. Prevention starts with understanding the risks. The number one cause of chronic lower respiratory diseases, especially COPD, is tobacco smoke. Most COPD cases are directly linked to smoking, which introduces thousands of harmful chemicals into your lungs. These chemicals inflame and damage lung tissue, leading to chronic bronchitis and emphysema. The more you smoke, the higher your risk. There's no safe level. But smoking isn't the only risk factor. Long-term exposure to secondhand smoke, dust, chemical fumes, or air pollution can also cause chronic lung disease. Jobs in mining, construction, or factories increase risk due to inhaled irritants. Burning wood or coal indoors without good ventilation is a major cause in many parts of the world. Genetics play a role too. A rare condition called alpha-1 antitrypsin deficiency makes lungs more vulnerable. Frequent lung infections in childhood can also increase risk later in life. Poorly controlled asthma over many years can cause permanent airway changes similar to COPD. While we can't change our genes, we can control many environmental risks. Understanding these causes empowers us to protect our lungs. Now let's talk about how to spot the symptoms early. Chronic lung diseases often start with subtle symptoms that are easy to ignore. A persistent cough, sometimes dry, sometimes with mucus, is often the first sign. Many dismiss it as a smoker's cough, but a cough that lingers for weeks or months is a warning. As the disease progresses, shortness of breath becomes the most noticeable symptom. At first, you might get winded climbing stairs or carrying groceries. Later, even simple tasks can leave you breathless. In advanced stages, breathlessness can occur even at rest. Wheezing, a high-pitched whistling sound when you breathe out, is common, caused by narrowed airways. Chest tightness, like a band squeezing your chest, can make deep breaths difficult. Fatigue and unintended weight loss are also common, as breathing takes more energy. Swelling in the ankles or a bluish tint to lips and nails signals low oxygen and needs urgent attention. Early recognition is crucial. Don't wait for an emergency. Talk to your doctor if you notice these symptoms. The sooner you act, the better your chances of managing the disease. Next, let's see how doctors diagnose these conditions. Early diagnosis can change the course of the disease. When you see a doctor for breathing problems, it starts with a detailed conversation and physical exam. Your doctor will ask about your symptoms, medical history, and exposure to lung irritants like smoke or chemicals. Listening to your lungs with a stethoscope helps detect wheezing or other abnormal sounds. A pulse oximeter checks your oxygen levels quickly and painlessly. The key test is spirometry, a simple breathing test that measures how much and how fast you can blow air out. Low results on spirometry confirm obstructive lung disease like COPD. Chest X-rays or CT scans may be used to rule out other problems and show lung damage. Blood tests can check oxygen levels or look for genetic conditions. All these tools help confirm the diagnosis and guide treatment. Early, accurate diagnosis is the first step to better breathing. While there's no cure for most chronic lung diseases, effective treatments can manage symptoms and improve quality of life. The most important step: quit smoking. It's the only proven way to slow lung damage. Inhalers are the mainstay of treatment, delivering medicine directly to the lungs. Bronchodilators relax airway muscles for easier breathing. Some work quickly, others provide long-term control. Inhaled steroids reduce airway inflammation, often combined with bronchodilators for best results. Prompt treatment of chest infections with antibiotics is vital to prevent dangerous flare-ups. Staying up to date on flu and pneumonia vaccines helps prevent serious infections. In advanced cases, oxygen therapy may be needed to maintain healthy oxygen levels. For severe disease, surgery or even lung transplant may be options. These treatments can help people stay active and independent. Managing chronic lung disease is about more than just medicine. Next, let's look at how lifestyle changes can make a big difference. Living well is possible with the right support. Living with chronic lung disease means more than taking medication. It's about building a lifestyle that supports your lungs. Pulmonary rehabilitation programs combine exercise education and support to help you breathe easier and stay active. Exercise strengthens breathing muscles and improves stamina, making daily activities less tiring. Learning proper inhaler use and breathing techniques like pursed lip and diaphragmatic breathing can help manage breathlessness. Nutrition matters. Breathing burns more calories, so eating enough protein and calories is essential. Small, frequent meals can prevent feeling too full, which can make breathing harder. Avoid foods that cause bloating and work with a dietitian if needed. Emotional health is just as important. Support groups and counseling can help manage stress, anxiety, or depression. Connecting with others facing similar challenges can make you feel less alone. Don't hesitate to seek help for your mental well-being. A holistic approach, physical, nutritional, and emotional, leads to better outcomes. With the right tools, you can live a full, active life. Next, let's talk about protecting your lungs for the future. The best way to fight chronic lung disease is to prevent it. Don't smoke, and if you do, make a plan to quit. The benefits start right away. Avoid secondhand smoke and other lung irritants at work and home. Use protective gear if you're exposed to dust or chemicals, and ensure good ventilation. Improve indoor air quality by avoiding strong chemical sprays and using exhaust fans. Pay attention to outdoor air quality and limit exposure on high pollution days. Regular exercise strengthens your lungs and heart. Aim for 30 minutes most days. Eat a balanced diet rich in fruits, vegetables, and antioxidants to protect lung cells. Practice good hygiene and stay up to date on vaccinations to prevent infections. Take respiratory infections seriously and allow time to recover. These simple steps can dramatically lower your risk of chronic lung disease. Protecting your lungs is an investment in your future health. Let's finish with a message of hope and empowerment. Living with a chronic lung disease can be tough, but there is hope. Modern treatments, rehabilitation, and support make it possible to live well with these conditions. A diagnosis is not the end. It's the start of actively managing your health. Your daily choices, using inhalers, eating well, exercising, and practicing breathing techniques, make a real difference. Small, consistent actions add up to better quality of life. You are the most important member of your healthcare team. Prevention is powerful. Don't smoke, advocate for clean air, and build healthy habits. Think of your lungs as a precious resource. Protect them for a lifetime of healthy breathing. Our breath connects us to life itself. Caring for it is fundamental self-care. Whether you're managing a condition or preventing one, you're not alone. Support is available. Embrace treatment, adopt healthy habits, and hold on to hope. You can breathe easier, live fuller, and take control of your health. Your breath is your life. Cherish and protect it.